it, sir, last time.
Dr. Pallavi, next. Next question. Okay. Elderly woman has epigastric pain, collapsed at home. In the ER, she has mild low back pain and the BP 90/60. What is the most likely diagnosis? Yes, doctor.
I think this should be a case of
Ruptured aneurysm, sir?
Very good. It is a
I would-
ruptured aortic aneurysm. The main clue is rupture suggestive of BP 90/60 and collapse. And patient is complaining of back pain, so that is a aortic aneurysm rupture. What, Dr. Madana, what is the, and Dr. Abraham, what is the presentation of mesenteric ischemia?
Sir, there will be
stomach
pain, but when we clinically examine the patient, it will not be as much as he tells.
Very good. So number one is symptoms are out of proportion to sign.
Yes, sir.
And so what is the confirmatory test?
Sir, CT angiography.
Very good. So CT angiography we will do, and it will suggest you of superior mesenteric vein or artery occlusion. And what is the symptom of gastric ulcer?
There will be epigastric discomfort,
Okay.
and then the pain will increase with eating.
Very good. Very good. And okay. Next question. So Dr. Madana, how will you treat gastric ulcer?
Sir, PPIs.
Okay. What is the dose?
Sir,
40
I don't know.
milligram.
Huh?
40 milligram.
Which drug?
Omeprazole.
Very good. If you are, so you will give OD or BD?
OD.
Very good. So when you will give BD dose in ulcer disease patient?
When there is bleeding?
Yes, very good. So if it is bleeding after hemostasis achievement, whenever we are planning discharge, then discharge with double dose, means BD. Otherwise, on OPD basis, it is always OD dose. Okay. A 3-year-old preterm female neonate is noted by the resident to have increased gastric residual volume and abdominal distension. On rectal examination, stool is heme positive. Lactate 2.9. Supine X-ray shows air in the bowel wall, but no free air in the peritoneum. What is the best next step in the management of condition? Yes, doctor. Dr. Madana.
Sir, I do not know the diagnosis, sir. I'm just thinking.
So it is a preterm baby having.
Okay, sir. Necrotizing enterocolitis.
Very good. So what is the next step?
Start on antibiotics, sir.
Very good. Very good. So the cause of necrotizing enterocolitis is bacterial infection because of preterm baby. So as early as possible, we have to start antibiotic. Okay.
Yes, sir.
Next. Dr. Pallavi, next question. Okay. A 74-year-old male with a history of aortic stenosis comes to the emergency department having 5 red black bowel movements over the last day. Means bleeding is there. His pulse 112, blood pressure 96/64. And what is the next best step? Bleeding patient, hemodynamically unstable. What is the next step?
Bolus of normal saline.
Very good. Very good. So when you will do colonoscopy?
Sir, in a stable patient, if the
So
same
after
patient is stable, we can, yes, sir.
after stabilization.
Okay, sir. Yes, sir.
Yeah. Next question. A healthcare worker gets stuck with a needle. Very important MCQ. Needle contaminated with blood from a person with chronic hepatitis B. The healthcare worker has never been vaccinated. What is the next best appropriate action? Immunoglobulin vaccine, only immunoglobulin, no treatment required.
A is the answer. We'll give immunoglobulin and vaccination for hepatitis B.
So
Because
option
it is
A.
not. Yes.
Very good. If healthcare worker is vaccinated, then what you will do?
We only give immunoglobulin.
No, sir, we have to
No.
check for the antibodies.
Very
And,
good. Which antibody?
sir, HBS.
Very good. Then
And then I'm not sure about it, sir. The levels are, I don't know if it is 10 or 100. So
10.
if it is,
If it is less,
yes, sir,
if it is less than 10, we give
we have to give
immunoglobulin. But
one.
if it's more than 10, we'll just give we don't give anything. We just give, yeah, I think so.
If it is less than 10, we have to give him one more booster dose, sir, of hep vaccine and immunoglobulin also. If it is more than 10, only immunoglobulin is enough.
So if it is more than 10, don't do anything.
No, sir, we
And
have to give immunoglobulin if it is more than
no,
10
no.
also.
If it is more than 10, then nothing is required.
Okay, sir. Okay, sir.
So patient is already immune. Matlab healthcare worker is immune. So if it is more than 10, don't do anything. And if it is less than 10, entire course of vaccination to repeat as well as immunoglobulin.
Okay, sir. Thank you, sir.
This is very important, and in day-to-day practice also you will see this type of patient. Next question. Dr. Pallavi. A 44-year-old female comes to see you because of pain in her epigastric area for the last several months. She denies nausea, vomiting, and weight loss or blood in the stool. On physical examination, you find no abnormalities. What is the most likely diagnosis? Duodenal ulcer, gastric ulcer, gastritis, pancreatitis, non-ulcer dyspepsia, and pancreatic cancer.
Gastric, I think. C.
Gastritis.
Yes.
But patient does not complain any luminal symptom in the form of nausea, vomiting. What is the answer? See, what happened in gastritis? Gastritis is the inflammation of stomach wall, correct? So
Yes,
in
sir.
which pain will be there, but always there will be a luminal symptom like regurgitation or nausea or vomiting. But if it is a non-ulcer dyspepsia, then this type of presentation will be there. So the correct answer is E.
Okay.
Doctor, what is the presentation of pancreatitis? What is the presentation of pancreatitis?
Epigastric pain. Most likely vomiting can be there.
No. Pancreatitis.
Oh, pancreatitis.
What is the presentation of pancreatitis?
Upper abdominal pain.
How was the pain?
A sharp pain.
Huh?
Irritating to the stove or back.
So remember one thing, in a acute pancreatitis, pain will be at upper abdomen. It will be a severe pain and continuous pain, and it will radiate to back and increase with food. So this is the classical presentation of pancreatitis. Okay.
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 And how will you treat pancreatitis?
IV fluid.
Very good. So IV fluid is the most important for a treatment of pancreatitis. You will give antibiotic?
If there is confirmation that it is septic pancreatitis, we can give antibiotics.
So if patient comes to you with acute pancreatitis day 2, you will give antibiotic or not?
No.
Very good. So there is no role of antibiotic in acute pancreatitis for first 7 days. It's only a inflammation, not infection. So we should avoid antibiotic. Okay.
Yes.
Next question, Dr. Pallavi. Hello. Very good. A 42-year-old male comes to the office with several weeks of epigastric pain radiating up under his chest, which becomes worse after lying flat for an hour. He has also a brackish taste in his mouth and sore throat. What is the most appropriate next step in his management? Epigastric pain radiating under his chest, worse after lying flat, and brackish taste in mouth and sore throat.
So this is GERD, GERD.
Hmm.
So next we have to go with the 24-hour pH monitoring. Or no,
We can give PPI trial, na?
yes, sir, we can give him PPI. Yes,
So what is which PPI among this list?
lansoprazole.
Very good. So lansoprazole we will give. And if it is improving, then don't worry. But if it is not improving, we should do endoscopy first. And if it is endoscopy also normal, and your index of suspicious is high, then we should do 24-hour pH meter. Okay.
Okay, sir.
Next question. Dr. Pallavi. PBC, which is the most accurate test? Very important. Most accurate test for PBC.
Antimicrobial antibody.
Very good. So it is highly sensitive and specific. So if you have one patient PBC and antimitochondrial antibody is positive, you will do liver biopsy or not?
No, I think no.
No, very good. Not required. Because if antimitochondrial antibody is positive, your diagnosis is confirmed. But if it is negative and still you are suspecting PBC, then you should do liver biopsy. Next. Dr. Pallavi. Next. 70-year-old male chronic hepatitis B virus antigen carrier screening of choice? Alpha fetoprotein, liver USG, alpha fetoprotein, tumor marker, CT, USG, CT, alpha fetoprotein.
A.
Very good.
Protein plus liver or ultrasound.
Very good. For what you will do screening? For what you will do screening test?
I don't get your question.
No. Why you are doing screening?
I think because
Patient is hepatitis B carrier, so for a early diagnosis of HCC, we should do every 6 monthly screening with alpha fetoprotein and sonography.
I didn't get, because of what?
For early diagnosis of hepatocellular carcinoma.
Oh, okay. Yeah. Thank you.
Next. Old patient with sense of fullness without pain in abdomen, no GI symptoms, no complaints, non-case of hypertension, diabetes. On examination, pulsatile mass in the mid-abdomen. What is the diagnosis? Dr. Madhana?
So is it
So
abdominal
abdominal
aneurysm?
aortic aneurysm. Yeah.
Very good. So it is aortic aneurysm. That's why pulsatile mass is there. What is the presentation of colon cancer? Dr. Madhana?
Sir, there might be bloody stools,
Very good.
pain abdomen.
Very good.
There could be constipation or diarrhea, sir.
Very good. Fantastic. And weight loss.
Weight loss, yes, sir.
So how will you confirm your diagnosis?
Colonoscopy, sir.
Very good. Colonoscopy and biopsy.
Yes, a biopsy.
Next question. A 56-year-old female comes to the clinic because her symptoms of epigastric pain from endoscopically confirmed duodenal ulcer have not responded to several weeks of PPI, clarithromycin, and amoxicillin. What is the next best step? Epigastric pain, endoscopically confirmed duodenal ulcer, not responded to H. pylori. What is the next best step?
Sir, can we switch from the triple therapy to quadruple therapy, like adding sucralfate?
Sucralfate is not the quadruple therapy regime.
Bismuth. Okay, sir.
So you should do urea breath test. Why? Because we have to see whether H. pylori is eradicated or not. Okay.
Okay, sir.
Which other test is used for a H. pylori is eradicated or not to see?
Endoscopy?
No, it is stool H. pylori antigen test. So urea breath test and stool H. pylori antigen test, these two tests is for eradication. once you complete the therapy, one of these two tests you should do for a confirmation. Okay. Next question. What is capsule endoscopy, Dr. Madana?
Sir, endoscopy, I know, I don't know. I have no idea about capsule endoscopy, sir.
Capsule endoscopy is for small bowel evaluation.
Okay, sir.
So patient has to swallow the capsule and there will be a camera inside.
Okay, sir.
So it will diagnose the small bowel pathology.
Okay, sir.
Next question,
Sir,
Doctor. Please.
sir, also the quadruple therapy, I thought it's sucralfate, sir. It's adding sucralfate to the triple therapy. What it is actually, sir?
It is bismuth.
Okay, sir. Okay, sir. Thank you, sir.
Quadruple therapy include bismuth and
Hmm.
sucralfate is not a part of quadruple therapy.
Okay, sir. Thank you, sir.
Yeah. A 64-year-old patient with diabetes for 20 years come to the office with several months of abdominal fullness, intermittent nausea, constipation, and sense of bloating. On physical examination, a splash is heard over the stomach on auscultation of the stomach when moving patient. What is the most appropriate next step in the management? Yes, Dr. Madana.
Sir, is this celiac disease?
No. Why?
No, sir, because bloating is there.
No, but on physical examination, there is a splash.
Yes,
Dr.
sir.
Pallavi, next slide, please. Next slide only. Dr. Pallavi.
Any obstruction, sir?
Yes, very good. Dr. Pallavi. So, no. Previous slide. Previous slide. Hello, Dr. Pallavi. Previous slide. No. Previous slide. Dr. Madana, 1 minute. Huh?
Sure, sir. Yes, sir.
Now, explanation of question number 34. This one. See, so this is whenever splash is there, you should suspect whether it is gastroparesis or obstruction. Dr. Madana.
Yes, sir.
So here we should give erythromycin for a gastroparesis.
Okay, sir.
Okay, and
Okay.
erythromycin has two use. One is as an antibiotic, and other is it is a prokinetic medicine also.
Okay, sir.
Next question, Dr. Pallavi. Dr. Pallavi. Next question, ma. Hi, another next slide. Bus 35. Okay, ma. A 75-year-old male admitted to the hospital with pneumonia. Several days after the start of antibiotics, he begins to have diarrhea. The Clostridium difficile toxin is positive. He started on metronidazole, which leads to resolution of diarrhea over a few days. 2 weeks later, diarrhea recurs and the Clostridium difficile toxin is again positive. What is the next best step? Dr. Madana.
Vancomycin.
Very good. So as per the current guideline, we should use vancomycin. If vancomycin first you have started and again recurrence, then we should give a second trial of vancomycin. Okay.
Okay, sir. Orally or intravenous, sir?
No, always orally.
Okay, sir.
Vancomycin.
Yeah. Next question, Dr. Pallavi. Which of the following is the most effective method of screening of colon cancer?
Colonoscopy, sir.
Colonoscopy.
Very good, very good. So colonoscopy is the most effective method of screening because we can visualize the entire colon, number one, and we simultaneously we can take biopsy also. The problem with sigmoidoscopy, we can see up to sigmoid colon only. Okay.
Yes, sir.
Next question. The problem is barium enema, we cannot take biopsy. Dr. Pallavi. Hello? Okay. A 54-year-old male evaluated in the office for fatigue, erectile dysfunction, and skin darkening. He is found to have transferrin saturation more than 50%. His SGOT 2 times upper limit of normal. What is the next best step? Dr. Madana, what is the diagnosis you are suspecting?
Sir, something like hemochromatosis.
Very good. So what is the next best step for confirmation?
Is it liver biopsy, sir? Confirmation would be liver biopsy.
No. It is MRI abdomen and HFE gene testing.
Okay, sir.
So it will do the confirmation of diagnosis. And what is the treatment of first line treatment of hemochromatosis?
Is it deferoxamine, sir?
No, first line therapy is phlebotomy.
Okay, sir.
And second line is ion chelator, that is deferoxamine or deferoxerox.
Okay, sir.
Next question, Dr. Pallavi. Next question. Okay. Obese, newly diagnosis, FBS 126 above, long list of lab comes to me in exam, screen, all normal including liver function test. On examination, patient had palpable mildly enlarged liver. What you will do?
Start him with biguanides.
What is the name of drug?
Metformin.
Very good. Why you want to give metformin?
That is the first line drug, sir.
And it
For
is
diabetes.
insulin sensitizer also.
Yes, sir.
That's why we will give first biguanide, that is metformin.
Yes, sir.
What is the problem with sulfonylureas? With sulfonylureas, the risk of hypoglycemia is very high. So we will avoid it.
Okay, sir.
Next question. Dr. Pallavi. 17-year-old young male presented with abdominal pain that is started periumbilical, then comes localized in the right iliac fossa. CBC shows high WBC count. What is the next step?
Ultrasound.
What is your diagnosis?
Appendicitis.
Very good. Perfect. Next question. Dr. Pallavi? A 47-year-old male, female presents to your clinic with 3-month history of dysphagia. There is no history of drastic weight loss, and the patient experiences symptoms when swallowing solid but not liquid. So it is a solid dysphagia, but no weight loss. Which of the following is not an obstructive cause of dysphagia?
E.
Huh?
E.
Very good. So it is a motility disorder, that is achalasia. That's why there is no weight loss. So any doubt, any question you want to ask from today's session?
I think it's clear.
Okay. Dr. Madhana, you have any question today?
Fine, sir. Like everything is fine, sir.
Okay. Okay. Bye-bye.
Yes. Thank you very much, sir.